If you've ever wondered whether what you see is truly what's normal, you're not alone. Questions about size, about adequacy, about confidence, they touch something deeper than we often acknowledge. And today, we're going to talk about one of those questions with honesty, clarity, and compassion. Well, I'm Dr. Naraya Wolf, urologist and pelvic surgeon, and if you ever face questions or concerns about your urological health, stay with us. We're here to help you understand your body with clarity and comfort. Today, we're exploring penile girth enhancement, what the research actually shows, what options exist, and what you need to know before considering any procedure. This isn't about judgment. It's about giving you the information you deserve so you can make decisions that are right for you. Before we dive in, I want to ask something simple. If this content helps you understand your health better, please subscribe and share this channel. Education like this matters, and the more people we can reach, the more we can help. Let's start with something that might surprise you. Research shows that more men express wanting penile enhancement than wanting to be taller. Think about that for a moment. In a study of over 26,000 men, nearly half said they desired a larger penis, while only about a third wanted increased height. Now, you might assume that men seeking enhancement are smaller than average. But here's what the data tells us. The vast majority of men pursuing these procedures fall well within normal size ranges. The issue isn't their anatomy, it's their perception of what's normal. When researchers ask men to estimate average flaccid length, many guess around 13 centimeters. The true average? Somewhere between 8 and 10 centimeters. That gap between perception and reality matters enormously. Studies suggest that up to 91% of men believe their penis is either too short or too thin, even when it's perfectly average. This brings us to body dysmorphia, a term you've probably heard. It refers to an intense preoccupation with a perceived flaw in your body, one that can lead to obsessive thoughts or compulsive behaviors. Among men seeking penile augmentation, true dysmorphia rates are actually relatively low, somewhere between 10 and 15%. But for those who do experience it, the impact is profound. They may avoid situations where they'd be naked in front of others, locker rooms, intimate encounters. They may develop significant performance anxiety. Their self-esteem can plummet. These aren't trivial concerns. They affect quality of life in real, measurable ways. So why do men pursue girth enhancement? The reasons are varied and deeply personal. Some want to improve self-confidence. Others feel insecure about appearance or function. Some hope to enhance their partner's pleasure. And yes, some have medical concerns that deserve attention. I've heard people say, women can get breast implants. Why can't men pursue cosmetic enhancement? It's a fair question. Years ago, I might have emphasized therapy and self-acceptance as the only path forward. And I still believe that addressing the psychological component is essential. But here's what I've come to understand. Even after doing all the inner work, some men still struggle. And if there are safe, effective options backed by solid research, perhaps those deserve consideration. The key word there is if, because safety and evidence matter enormously. Let me start by addressing something you've probably seen advertised: pills, gummies, supplements claiming to increase size. I want to be direct with you. There is no scientific evidence supporting any oral treatment for penile enlargement. None. These products aren't FDA approved. They often contain unlisted ingredients, some of which can be harmful. And yet, the so-called natural male enhancement industry is massive, projected to reach nearly $600 billion by 2025. That's a lot of money built on hope and misinformation. So let's talk about what the actual research shows. A recent comprehensive review examined all available literature on penile girth enhancement. They found 29 studies covering about 3,500 patients. But, and this is important, only 5 of those studies included more than 100 participants, and only 10 tracked patients for more than a year. What does that tell us? The evidence base is limited. Study quality is generally low. Long-term data is scarce. This doesn't mean nothing works. It means we need to be cautious and realistic about expectations. Let's walk through the options, starting with the least invasive. Vacuum erection devices. These devices temporarily draw blood into the penis, creating temporary enlargement. But do they create lasting change? The research says no. Most protocols involve about 20 minutes, 3 times weekly. Studies show minimal size increase and low satisfaction rates. Penile traction devices. These work through continuous force, sort of like orthodontic braces slowly repositioning teeth. Some studies show modest length gains when used 4 to 6 hours daily, but girth enhancement? Not really. If you're interested in length specifically, I have another video covering that topic. Now let's move to injections, an area with more complexity and more risk. Autologous fat injections. This involves harvesting fat through liposuction, usually from the thigh or abdomen, then injecting it beneath penile skin. One study of 88 men showed girth gains around 2.5 centimeters, lasting up to a year in 60 to 80% of patients. Sounds promising, right? But here's the problem. Complications occur. About 2% developed issues requiring corrective surgery. Fat cells don't always survive well when transplanted. They can form irregular nodules, cause scarring, or create cosmetic deformities. In rare cases, sensation changes occur. And tragically, one patient died from a fat embolism shortly after injection. Silicone injections. Liquid silicone was used starting in the 1970s. The results? Severe swelling, distortion, formations called silicone granulomas, and sexual dysfunction, sometimes appearing up to 30 years later. There have been attempts with microdroplet techniques using tiny volumes monthly, but the data is limited and follow-up poor. I cannot recommend silicone injections. Hyaluronic acid fillers. These are commonly used cosmetically on faces and lips. For penile enhancement, early approaches used large volumes, 20 milliliters or more, achieving significant girth increases but causing decreased sensation and less firm erections. Current approaches use smaller volumes more frequently, trying to balance enhancement with sensation. But here's the catch. Hyaluronic acid isn't permanent. Results diminish over time. Polymethyl methacrylate, PMMA. This non-absorbable filler has shown girth gains around 2.5 centimeters and even slight length increases due to its stiffness. But about half of patients develop nodules, ridges, or indentations. If you need it removed, the process is difficult and can cause deformity, erectile dysfunction, pain, or tissue fibrosis. Long-term data is lacking. Now let's discuss surgical options. Complication rates vary dramatically across studies, from under 10% to, in some reports, 100%. Common complications include swelling, scarring, skin necrosis, ulcers, wound infections, and the need for additional surgery. Tissue grafts. Some procedures use grafts from the groin containing skin layers and fat. In one small study of 11 patients, girth increased about 2 to 2.5 centimeters, but 7 of those 11 experienced complications: swelling, pain with erections, temporary curvature, general discomfort. Another study used porcine dermal grafts, pig-derived tissue, in 69 men, inserted through a small incision at the penile base. Girth increased 2 to 3 centimeters. However, 13 patients developed graft fibrosis, causing penile shortening by up to 0.5 centimeter. Penile implants. There's a device called the Penuma implant. Initial published data seemed reasonable, but since then, increasing reports of complications requiring revision surgery have emerged. The device has been revised in response, but the true complication rate remains unclear because many patients seek care elsewhere rather than returning to their original surgeon. Corporal augmentation. This involves grafting vein tissue directly onto the erectile tissue. One study of 39 patients showed diameter increases of about 1.25 centimeters during erection, but not while flaccid. Nearly 40% experienced temporary curvature, though it resolved within 3 months. This is radical invasive surgery with limited research. I cannot recommend it based on current evidence. Here's the reality. There is no consensus among expert guidelines on a standardized, accepted method for penile girth enhancement. Complications are likely underreported because patients often don't return to their original surgeons. Most procedures are considered experimental. If you're seriously considering any of these options, I strongly encourage thorough research. Understand the risks. Speak with multiple qualified urologists. Consider the psychological component. Sometimes therapy addresses underlying concerns more effectively than any procedure. And please be cautious of clinics promising dramatic results with minimal risk. If something sounds too good to be true, it probably is. I know these conversations aren't easy. Questions about your body, about how you measure up, about whether you're enough. They can carry so much weight. But here's what I want you to know. Your value doesn't reside in measurements. Your worth isn't determined by size. That doesn't mean your concerns aren't real or valid. They are. And if you're struggling, talking with a therapist who specializes in sexual health can be profoundly helpful. Working through feelings of inadequacy, anxiety, or insecurity often brings more lasting peace than any procedure. If medical intervention feels right for you, please ensure you're working with experienced, board-certified urologists who prioritize your safety and informed consent. Ask questions, understand risks, don't rush. Your health, physical and emotional, matters. And whether you choose treatment or choose acceptance, I hope you'll remember this. You deserve care, honesty, and respect. You deserve to understand your options fully, and you deserve to feel at peace in your own body. If you found this helpful, please subscribe. Share it with someone who might benefit. And remember, taking care of yourself isn't just about procedures or protocols. It's about treating yourself with the same kindness you'd offer someone you love, because you're worth it.